Center is your community hospital, committed to making life better for the communities we are privileged to serve. In fact, better is our mission, improving lives through personalized health and care. What matters most to our patients matters most to us, offering a comprehensive range of inpatient, outpatient, and emergency care services so you can get the quality care you need right here at home. San Juan Regional Medical Center, celebrating life better here since 1910. Past 8 o'clock. It is Thursday morning. Today is August the 25th, 2022. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air, of course, here in San Juan County. In Durango, Colorado, we're broadcasting at 103.3 FM. And, of course, everywhere else on the planet, you can always tune in by going to KSJE.com or asking your smart speaker to play KSJE. We also welcome our viewers who are watching this visual radio program. It is being video streamed live to the KSJE Facebook page, our YouTube channel, and our Twitter account. So we're glad that you are with us this morning, everybody, because coming up today, my guest from the San Juan County Partnership, we're getting an update on some of the programs that are going on with the partnership and some of their efforts in local schools to send prevention information and educate kids about that important part of prevention. That's coming up today in the next few moments right here on KSJE. And then later on this morning, we'll be talking about the Concert for Critters. It is happening Labor Day weekend up in Cortez to benefit 3 local animal rescue organizations. Some great entertainment lined up for this benefit concert. We'll talk more about that coming up today at 8:50 a.m. on KSJE, so we hope you'll stay tuned for that interview as well. Next hour, Mick Hess is going to take us roving with the arts. He's featuring music from both Silvestrov and Tchaikovsky. You'll hear music from both of those composers today. Next hour, 9:06 on KSJE. In addition to our YouTube and Facebook and Twitter accounts, you can also connect with KSJE on our Instagram page also. And if you're a podcast person, we invite you to subscribe for free to KSJE Podcast, wherever you listen to podcasts, and maybe discover a new program that you may have missed recently. They're published each and every day. Outside our studios here at San Juan College, it is a partly cloudy morning this morning, 67 degrees at the moment with humidity at 58%. We're expecting a partly sunny day today with maybe a 50% chance of a scattered shower or thunderstorm popping up this afternoon. The high today, 85 in Farmington, 64 overnight. Another 50% chance of rain showers in the forecast for Friday with a high of 82 tomorrow. Drier weather, though, beginning on Saturday with a high of 86, 88 on Sunday, back into the upper 80s by Monday, Tuesday, and Wednesday, with lots of sunshine in the forecast for next week. Well, let me turn to my guest, who is here with me this morning, as I mentioned, from the San Juan County Partnership. Amanda Evans is back here in the studio with me. Good morning. Always good to see you. Welcome back to KSJE.
Good morning. It's nice to be here.
You bet. And so the work continues at the San Juan County Partnership, correct?
Always.
You've been busy.
Yep. Yes, we've always got something going on.
Right. So what's going on these days?
We have a lot with school ramping back up. We've got a lot of fall programmings going on. We're going to start doing Tobacco Merchant Ed, which is where we go out into the community and visit tobacco merchants and talk to them, remind them about the rules, remind them about checking IDs, not being able to sell to 21, go through just kind of the laws in the state and spend some time answering their questions as well.
Very good. Do you find that some other merchants aren't as familiar as maybe you'd like them to be about tobacco laws and regulations when you do this type of exercise?
Well, I think that a lot of them know. It's just always a good reminder because we do have actually compliance checks through the law enforcement on the SIU side. So we just want to make sure they're remembering those. Some people think we're trying to trick them into getting caught, but really we want them to not be selling. So we're trying to make sure they're just following, and they get new staff in. They might have staff turnover. Just making sure they're doing their education each time they get a new clerk. things like that. And we have had some law changes over the last few years. We went from 18 as the legal age to 21 with all the new vaping stuff that's out. There's laws around that. So, sometimes it's just nuances that they might have missed. And we've also had the state just pass this last couple of years where retailers have to be have a license now, where before they didn't. So that's one that...
To sell tobacco?
Yes.
Okay.
So they have to apply for a license through the state to be able to sell now.
Gotcha.
And that's a new one.
Right. And so you may find people that aren't aware of that, and you can tell them, I guess, right, before they do get fined, I suppose, right?
Yes, that's what we want to do, is we want to make sure they have what they need from the state, from us, just from their community, to be able to, make good decisions for our area.
Right. Right. And vaping, I know, is a more relatively recent addition to sales and things like that. And so they fall under some of these laws, but are there some specific laws specific to just vaping and vaping material?
It's more that they're just under this kind of the state law, and then when federal stuff comes down. But like our state does not allow you to sell vaping products to under 21, just like tobacco. But that also includes the components, which some people might not be aware of. So it's not just like you can't get any of the aspects of that to go make your own if you're under 21 as well.
Got you. Good to know. And this is something that the partnership does pretty regularly, like is it once a year?
Yes.
So this time of year is when you do it?
Yep. I've been doing this about 10 years now. So we go out, usually it's September through November. We try to visit. We have 70 to 75 merchants we visit. We have another group that comes in sometimes to fill in those gaps because, in the past we've had up to 120, 130 people or businesses that are selling in the community. So,
right.
Yep, we're trying out there getting them their information. We give them a packet with all of the laws so they have it, signage they can put up in their store, things like that. So we try to get out there, by mid-November.
Right.
And get all these seen.
And again, these efforts kind of go back to your mission, right, of the San Juan County Partnership of kind of prevention, right, and trying to kind of, help avoid some of these things down the road. If we can prevent them now, then that kind of helps things in the future.
Yes, it's always easier to keep somebody from starting than to try to help somebody once they've started, especially because, tobacco products and a lot of vaping products people don't realize do have nicotine in them. So they're just as harmful as tobacco can be, sometimes more so because it has different effects depending on, there's not as much laws around what can be in the products as there are tobacco.
Right. And we know how highly addictive some of those things can be, and that's part of the concern. I would think, too, that these things can be highly addictive because of just the way they're marketed and the way they're maybe available when it shouldn't be to younger people.
They are. That we're seeing a huge increase of young people vaping and then switching to tobacco later on. And so, vaping products have really been marketed as a tool to get off of smoking. And they do, for some people, they have a place for that. But overall, for our young people, that's not what's happening. It's actually the opposite. We're seeing them start with vaping because it is cool looking. It's easy. It doesn't smell the way, tobacco and cigarettes do. It's more acceptable in the community, in places and businesses and stuff. And so they start with vaping and then they go on to tobacco, and then then you start seeing all these same issues that we've had with tobacco before.
Right. Interesting. So by getting the word out, that's got to be helpful. And part of that, too, is the work that you do in the schools. And this is probably the time of year when you are reaching out to school districts and others to try to find time to come in with some of the presentations that the partnership is known for. Yes,
and we've got some new ones that I'm really excited about. We are still doing our same ones that we have, like we call it our perception of risk, which talks about DWI, which talks about underage drinking, those kind of things, the body, what happens to a body when you're drinking heavily or even moderately as a young person, brain development stuff. But a new one that we have another staff member doing that we just did in Shiprock at their youth conference, like in July, I think it was. And it is on how some of these things hide in plain sight in a way. And so with alcohol, we have drinks that look really alcoholic beverages in those stores, convenience stores, grocery stores, that look really similar to other products. And so we talk about, being aware of, if you go to a friend's house and you're getting a drink out of the fridge, do you know what's in it? Or, and then now,
because it may look like a soda pop or something, right? Is that what you're saying? Or just something non-alcoholic? Yeah,
we have a display we use. There are cans and bottles of root beer that have hard root beer, and they look exactly the same. Some of them you can taste the difference as soon as you taste it, but we've done this display for years at different events, and I had a woman come up and tell me that her mother, who was in her 70s, had gone to a convenience store, purchased some of those teas, like the flavored teas, like a raspberry tea.
Right.
Went home, drank it, called her daughter, was like, I feel really weird. And she went over, and both of them were alcoholic, and they hadn't carded her because she was 70.
Older, right?
Yes.
Looking, sure. Okay.
And so, even it's not just kids, you be aware. Some of them are really tiny wording on the packaging. Some of them only say hard, spiked, these things that maybe not everybody, if you're not a drinker, knows about. So,
right.
And then we've also got cannabis products now coming into it, where you've got gummy bears and you've got different food items that can also have something you might not be aware of in it.
Right. And so you have programs to try to educate youth about some of these things and what to watch for and things along that line. Is that kind of what you hope to take to the schools to educate these younger people?
Yes. What we're kind of doing is we're going to offer kind of two versions of it. One for parents, so they kind of have an awareness, especially if you're a cannabis user who has it in your home. We want to make sure you're locking it up. We want to make sure you're keeping it out of your kids' reach. And then for the other side is making kids aware, because, especially for younger kids, if they're in a home that doesn't have alcohol in the fridge every night, maybe they don't know what hard lemonade means. So they go over to somebody's house and, hey, it's a hard lemonade in the fridge, and they don't know what that is.
Well,
so.
Sure. I don't want easy lemonade, so,
Exactly.
I'm going to open up that can instead. Right.
Maybe it's just extra sour. I don't know. Right. So
Interesting. And the cannabis thing is, of course, relatively new to our state because of the recent legalization of marijuana and marijuana-associated products. And so that's what you're talking about, is some of these edibles that are now widely available, I would think, and maybe not under lock and key, and so they're available potentially to younger people who shouldn't be having it.
Yes, and we have had some great response from our cannabis shops in this community. One of my coworkers, Julie, has been working really hard with getting guidebooks into their stores so people can pick up something that helps them know what the laws are around use, and what the laws are around locking it up, and things like, and tips for how to keep it safe. Because we're not, it is a legal product now. We're not telling adults over 21 they can't or shouldn't. That's a decision they have to make. But kids' brains are still developing until they're in the mid-20s, and so it's not the best choices for them to be making. And we just want parents, and youth to be aware of what's out there in the community. They could have either intentionally or unintentionally. Right.
I'm glad to hear that the shops are responsive and working with you. I think they want to be responsible in the business community and have their products used responsibly by the people that are supposed to be and legally able to use their products.
And they have been really great about letting us we've had some that even, gave us some feedback as we were developing this guidebook. And so it's been great to be able to have that out there. And so all of this kind of ties together. That's what we want to do. Is we have social media coming out around some of these things. We have the stuff in the schools, hopefully. We have the stuff in, the businesses. So it's kind of a comprehensive approach is what we want to look at.
Right. And getting the message out through the schools too, probably.
Yes. We've always tried to work with schools. We can do presentations for like a large group. We've gone in and done them for like a whole school, broken up by grade. We can go in into health classes and teach a lesson on, something that might fit with alcohol and substances under that. So there's a lot of ways we can tailor what message we are to what your school's doing.
Right. Which is a great thing. And it's really not that far removed from the other messages that we've been hearing from the San Juan County Partnership all these years about prescription drug securing your prescription drugs at home and things along that line to make sure that kids can't get a hold of those things, those pills and things that we know cause difficulties as well. It's kind of the same type of messaging, I think.
Yeah, it's really actually exactly the same type of messaging. Some of our messaging actually has been just lock up anything that's, that your kids shouldn't have. And so it's prescription drugs, it's cannabis, it's your alcohol even. Even if you have a really nice bar and you have, liquor out somewhere, make sure there's a lock on it and make sure your kids can't, and that you talk to your kids even more so than that, is starting those conversations with them so they know what your views are about drinking and using cannabis and using all these products.
Right. Maybe not just to say lock it up, but maybe tell the kids, here's why we're locking it up.
Yes.
And why you shouldn't have access to it.
Yes.
Until you're older. Those
Yep.
types of things. So.
Yep. And we actually have lock boxes now that you can get from us at the partnership. So we have a couple different, we have a lock box, and then we have a couple cabinet locks as well. So some of those work really well for like alcohol in your cabinets, and then the lock box, if you have a cannabis in your house, it's more something you can fit some pill bottles or cannabis or something in.
Gotcha. Very good. That's good to know. My guest this morning, Amanda Evans, is here. She's with the San Juan County Partnership. We are talking about some of the programs that the partnership, of course, is doing and some of the prevention messaging that they are spreading throughout the area. You mentioned social media, of course, one of my favorite topics.
Yes.
And so, but I want to ask you, because it really is, we love it and then we hate it, because we love it and we hate it. And it just is so invasive into our everyday lives, and we love it to stay connected with family and friends and things that's going on in our community. But there are also things that we see on social media that can be very persuasive and very maybe negative impacting for young people if they're not sure what they're looking at.
Yeah, and it's really, that's what we want to do is, there's an overwhelming amount of information out there, and myself included, took a vacation recently and took myself off social media for a few days. So we definitely, for your mental health, do what you need to. But if you're going to be on social media, we want to tailor those messages so you're getting both sides of it. And so we've been running some information about the lock boxes. We've been running some information about safe storage, safe usage, starting the conversation on some of these products with parents. And so it's part of our daily life now. So we want to make sure that those messages have a part of that.
Right. And certainly some social media are geared more towards maybe the older population, but certainly teenagers and young people are on certain other social media. I'm thinking like the TikToks of the world and the
Yes.
Snapchats of the world and things along that line. And so I think parents need to be aware that kids are maybe active on some of these other platforms, even if parents are not.
Yes, and we have seen, TikTok is very, there's a wide variety on that app.
That's a good way to say it.
Trying,
As a mom, I understand where you're coming from.
Exactly. I do. I have a 13-year-old, so, we make sure we know what she's on and what she can see and what her phone has access to. And there are times she gets a little frustrated with me when she has to get permission to download an app. But that's the choice we've made. And so, there is, for each family, they have to decide what's right for their family, but it's always best to have some information about what your kids are getting into, because there's a lot of messaging out there that maybe you don't even know about that's going on. And not just TikTok, but there's Instagram, there's, Snapchat, there's all these different apps. And so just even having those conversations, like, what are you seeing as a kid, talking to your kids, that's one of the best things we see when we do these surveys with youth. Some of our questions are around resiliency factors, which that's what is more likely to make your kids successful later on. And one of the hugest factors is an adult who cares about them in their life.
Just any adult.
If
it's a parent, all the better, but
yes.
Even other positive adult influences have to be a good thing.
Yes, teachers in their life. It's for some families, their parents may not be around, so grandparents, aunts, uncles, anybody in there that can be a positive influence and that they can trust and go to with these questions. Maybe they see a TikTok and they don't understand what it means. You want them to trust you enough to go to you and talk to about it.
Right. Right. Very true. You mentioned the surveys that you do, and I always like to point out that you get a lot of data from local kids, not from other parts of the state, but San Juan County kids. And so it really tells us kind of how they're doing with stuff and life and influences and things along that line. And many times, which I find refreshing and grateful, that the majority of the kids are doing the right thing and are making the right choices. Not everyone is breaking into their parents' cannabis stashes and bars and things like that. And so that's really a positive thing that I really think it's always great to share with our audiences about the survey results that you get.
Yes, we have a couple different. We use the YRRS, which is the Youth Risk and Resiliency Survey, and that's one the state does every other year. And so we use that a lot because it includes most of the counties, the schools. We're going to be doing our own survey in some of the schools this fall, hopefully, or next spring, depending on how that goes, which will give us a little quicker response back, just because waiting for the state to get information can take some time, especially with everything that's gone on the last couple of years. But we want to use local data because we know, our schools are not having the same issues maybe as Albuquerque. Some of the same issues, but it may look differently than Santa Fe or Albuquerque or even Las Cruces or, even Gallup, which is closer to us. So we want to make sure we know what's going on in our community. And so those surveys really are helpful to us as we do prevention, to the schools as they make decisions. So they're just really a great tool to be able to use. And you're right, we have a lot of kids making really good decisions. And unfortunately, some of that gets overshadowed by some of the, because we do want to be concerned about that 10% or 8% or whatever the stat is of the kids who are using something they're not supposed to. But we really do want to reinforce that, a lot of cases, 90% of our youth or 80% of our youth are making really great decisions.
And that's, I think, worth celebrating and worth repeating.
Yes.
Which is why I ask you every time you're here
yes.
to do that, because I think it's important that the folks know. And it is that high? I said majority, but that's really a high amount. I know it probably depends on certain instances of what we're talking about, right? But if we're talking about maybe drinking alcohol, there's a stat for that.
Yes, and I'll apologize. I didn't bring them with me this morning.
I'm putting you on the spot.
No, I actually usually try to bring at least one or two, and I didn't. It's the start of school.
I understand.
I wasn't prepared.
We've already established that you're a mom, so
yes,
there you go.
It threw me off this week, but
not a problem.
but you can.
But it is the majority, right? It's still the majority of kids aren't abusing alcohol. Isn't that what we find?
And we are seeing some different trends because of the last 2 years. COVID's impacted that, so we've trended down on alcohol for years, and so I have not seen the most recent stats even specifically. I think there's still some lag in some of that because the state's been busy dealing with this pandemic and stuff. So but there is the Department of Health's website. You can go on there. If you type in Youth Risk and Resiliency Survey for New Mexico, you can look at all the different reports and see the data yourself. But alcohol is one where we usually do have a majority of kids that are not using alcohol, especially in the really harmful ways. Binge drinking is one we really are concerned about because that's drinking large quantities in a small amount of time.
Right. And you asked specifically about that too, right?
And so, the ones we really want to look at the most are binge drinking, drinking and driving, riding with someone who's been drinking. And so, those factors are even more important than, well, not more important, but are a big component of the health of whether, if a kid's tried alcohol once versus is binge drinking every weekend. That's, really different perspectives.
True. So. Very true. And important to kind of distinguish between the two, I think, in those results.
Yes.
So there you go. And I figured that those results are available somewhere. And you mentioned the Department of Health website, which is another great resource for folks. Very true. Before I let you go and we run out of time, I wanted to ask you about, I know the partnership is very active in educating the community about opioid abuse and problems with opioids in the community and things along that line. Where do we stand on that problem these days? We're still seeing it, certainly. It's still a big impact, right?
Yes, we're definitely still seeing it. We've also had fentanyl coming into the area, so that's been a huge thing that our law enforcement, our Region 2 narcotics are dealing with. And so we have a community action coalition that meets monthly with law enforcement, with our prevention organizations, with our treatment organizations, and talk about those issues, especially the opioid stuff, what's coming up with it. We've been partnering to bring like a resource. We already have a resource guide, but we've created a QR code that can be put out there for law enforcement to use. We've had some different national partners come in to help law enforcement with some of those, bringing them some resources, Narcan, things like that. We've got a huge campaign. We've got some billboards up around Narcan use because that's really what's saving lives. There's kind of a belief that Narcan won't work on fentanyl, but that's not true. Sometimes it takes multiple doses. So we're trying to get that word out because, if you're dealing with someone you know is overdosing and you don't know whether it's just a prescription opioid or fentanyl, you can, it may take 2 doses of the Narcan, which is something that not everyone knows. So we're really trying to make sure the Narcan's available to people. We are doing trainings through the partnership. So if you have an organization and your staff deals with clients or consumers or other people who might be at risk for an overdose, we can train your whole staff and we have free Narcan to give to the staff so they have it with them.
And Narcan is really this, I say amazing treatment, but it really kind of is, right? Because it can kind of stop the effects of an overdose pretty quickly on a person, right?
Yes.
Right there in the street, in the park, and wherever they're having this overdose reaction, correct?
Yes, and we, first I do want to make a disclaimer, always call 911. So
True.
Even if you have Narcan, because there is a chance that it can, you reverse them, they come back, and then they can relapse again. So the first thing is always call 911. But yes, Narcan is amazing because the one great thing is it has no bad side effects. If you give Narcan to someone, that you think might be overdosing and it's not an overdose, it's not going to harm them. Your kids get into Narcan and, spray it because it's a nasal spray. It's not going to hurt them. So it's really, there is no downside to having it in your medicine cabinet. If you are someone who has a prescription drug, you may never plan on overdosing, but, we even say, we had a pharmacist that she tells patients, what if your dog eats one of your pills? This will actually save them too.
Wow.
So,
right. Okay.
Your kid gets in it. I've heard stories where people were out just driving and there was a wreck in front of them and they found out the patient was overdosing, and you can use Narcan to save someone. So it may not even be someone so we recommend it really. If you have a first aid kit, it should go in there.
Got it. And it's available, as you mentioned, for free from a lot of different community organizations like yours.
Yes.
Right? For some instances.
Yeah. It just depends on the situation, but we can always help someone. If we can't provide it to you, then we can help you get it from somewhere else. The other great thing is you can get it at any pharmacy without a prescription because our pharmacists throughout the whole state are licensed to do it without prescription. So you can go to Safeway or Smith's or somewhere and ask for that, and they can help you get it. If you have insurance, there may be a copay for it. It can be a little expensive if you don't have any insurance, but again, if you need it, go to a pharmacist and say, I can't afford it, help me find some resources, and there are places in the community where you can get it.
Good to know. Very good to know. And again, it's really just that amazing that it's being made available. I think all EMS and law enforcement now have access to it when they're out on patrols and responding and things along that line. And of course, if you don't have that and someone is overdosing, it can be fatal.
Yes, and a fentanyl overdose can happen really quickly because we do know it's stronger than, just an opioid painkiller you might have in your house from a prescription. And so it can be both of them can be dangerous and happen really fast. And so, again, the first step is always call 911, and then the next step is to give them Narcan.
There you go. Good advice, as always. Thank you for the work that you do and the rest of the San Juan County Partnership in our community. Amanda, thanks for coming in.
Thank you for having me.
You bet. That's Amanda Evans with the San Juan County Partnership, my guest this morning here on KSJE. KSJE is proud to support the Summer Terrace Concert Series, Saturdays at the Farmington Museum. Saturday, August 20th, Rock, Blues, and Country with Black Velvet. Saturday, August 27th, Jazz with Didat. The Summer Terrace Concert Series at the Farmington Museum, 3041 East Main Street, Saturdays this summer from 6 to 7:30 p.m.
When more screen time can be good.